Hello everyone, welcome to my channel. Today we will be discussing about allergies. This is a part of the chapter Health and Diseases Class 12 CBS. We have already discussed what is various kinds of diseases that we have, then what are various viral diseases, fungal diseases, along with the symptoms. We have talked about immune system, we have talked about immunity. So now coming to allergies. So we will be going ahead, we will be talking about what is allergy, what causes allergies, how can we detect allergy and cure allergies. Okay, so now if we go ahead, if we look here, we will see allergy means what? It is an exaggerated response of immune system to certain antigens present in the environment. This is allergy. So when you have an extensive response to any kind of particles or any kind of antigens which is attacking you, we say it is allergy. And the substance which is causing this kind of immune response, they are known as allergens. That means the causative agent is an allergen, and what is the response that has been occurred? That is allergy. Say, I am dusting, I have just inhaled dust and I start sneezing. So the dust becomes my allergen, and the sneezing that has occurred, this is the response. So this is the allergy that has occurred. Okay. So the antibody which is produced, that is IgE type. So we have the B cells, the allergens will come and it will go and sit on the B cell. And then what happens? The production of IgE will take place. So once this IgE will start producing, will start acting, then after that, what we will have? We will have the histamines, which is being produced, which is causing the allergic reactions. So it is basically, we say hypersensitive or hyperhistamine diseases or the allergies that is there. Now some examples of allergens are mites and dust, pollen, animal dander, etc. that we have. So if we come about allergic reactions by skin contact, say there was a poisonous plant, some poison in the plant is there, so that can cause effect. Animal scratches again can be allergic for few people. Pollens, latex. So once all these things they come in contact with the skin, again allergies would start. Injection, like the sting of a bee, that also can be allergic. That is, it is stinging, it is injecting some chemicals into the skin, and hence we are getting allergy. It can be a bee sting or any kind of stings of any insects and all would do. Okay. Ingestion means something that we are eating. We can be allergic to few medicines. Okay. So if we see a doctor would ask us whether we are allergic to this kind of medicine, penicillin, etc., various antibiotics. People may be allergic to, or some people might be allergic to prawns, nuts. So whatever they are having, brinjal, they are allergic to brinjals like this. This kinds of allergies are due to ingestion of a thing or you're eating a thing. Inhalation, you are smelling, so it can be a pollen. Pollen may come in contact to the skin as well. If you're inhaling pollen, it can cause allergy. So that is inhalation. Dust allergy, again you're inhaling the dust. Mold or mildew, all this, or animal dander. So these all are allergies based on what is the type of it. Now, when I talk about the symptom of allergy, I might have watery eyes. There might be running nose or difficulty in breathing. All these types of things might be there. A cough might be there. Headache would be there. Some might have rashes in the skin. Say you eat a brinjal or something like that. Then after that, if you're allergic to brinjal, you might start having rashes. Okay. You might have coughing. You might start sneezing, like pollen, dust. You tend to get sneeze. Eyes reddened up. So itchy. If you are allergic to some, stings and all those, there might be itchy skin is there. Okay. Even when I say skin contact with the pollens, there might be itchy skin. Then runny nose. That also is a symptom of allergy. Okay. Then lacrimation from the eyes. Your tears might be rolling up from the eyes. Then burning and dry skin also can occur. So I have taken a very simple example of a spice allergy. Many people are allergic to spices. Okay, so spices would mean a kind of pepper, garlic, they might be allergic to all these things. So now when they're allergic to all these things, then what would happen? Say they eat it up. When they eat it up, they might have a stomach bloating, they might have diarrhea, they might have rashes, hives that might happen in the skin and all those. They might have nausea. Okay. So they feel like vomiting and all those. They might have a congestion or a runny nose. They might have that. Some might have shortness of breaths. Rashes would be there. Swelling of the lips also can be there. Lips would get swollen up. So all these kinds of symptoms you might find in a person who is allergic to some kind of spices. So all these things are, allergic. So here, what is the allergen? Allergen is the spice. And the allergy, what are the symptoms of allergy? Are all these things that I've talked to you about. Now, allergy, I told you, is due to some release of chemicals like histamine, serotonin from the mast cell. So how does it occur? There is an initial contact of the person with the allergen. So once there is a contact with the allergen, then what will happen? The allergens will come and sit on the plasma cells or the B cells that I talked to you about. So B lymphocytes is coming and sitting. Once it is sitting with the B lymphocytes, then what did I tell it will happen? It will release IgE antibodies, right? Just before some time I said you, it will release IgE antibodies. Okay? Now, these IgE antibodies will come and sit on the receptors of the mast cell. Okay. Now, what do the mast cells will do? This mast cell will there is a subsequent contact. Second time when you have a contact with the allergen, now it is keeping it in the memory. This is an allergen I'm allergic to. I'm allergic to pollen grain means this is again the pollen grain has come in contact with the skin. Hence, it will remember it. Antibodies, you remember, it will always remember. It's a memory cell it has and it will start producing the antibodies. What is immunoglobulin? It is again the antibody. I've talked to you in the place of when I have talked about the antibodies, immunoglobulins, the structure and all those. So once you are in contact with the pollen grain again, so what is happening? It is going and it is releasing histamine. So the histamine inflammatory response is there and there is an allergic reaction that you would have. Okay. Now, I am telling that there will be allergic reactions. So all these things, how will I know what am I allergic to? So for this, there are various tests. There is a diagnosis that is there for me to find out what am I allergic to. Allergy testing, it has got different procedures. A lot of hospitals are staffed with allergy testing specialists and highly qualified immunologists. So make sure that with the help of your GP, you go to the right person. So for determining the cause of allergy, the patient is exposed to or injected with a very small dose of possible allergen and the reaction is studied. So what are the different kinds of allergies I have? Skin prick test. Skin prick test, if I tell, this is a primary method is considered in the primary method of diagnosis for most allergens. And this is a very common test. Okay. But particularly for low risk cases where systemic allergic reactions have been observed. Prick enables a small amount of purified allergen to penetrate. If the patient is allergic to the substance, there will be a reaction within 20 minutes. Okay, so they are going and they're just pricking a small amount of allergen into the skin, and they will be marking the area where they are putting the allergen. If they find any kind of inflammation in that area within 20 minutes of a time, which is even continued for a 24 hours, they tell not to put any water or something on that. They find out, and in case if everything is all right, then they go ahead and medicating accordingly. Okay. Next is specified IgE blood test. Now, what is specified IgE blood test? This test is recommended by the GP when the skin testing is not possible or is non-conclusive. Say skin test, the prick test is not possible. Then they will say, okay, they will establish a level of IgE in the blood. This results indicate to specialists when allergens is the culprit. Okay, so you are not able to go ahead. And next we have a patch test. Patch test means what? This form is commonly used to diagnose contact dermatitis. If you are in a case of there's a contact of allergy, like allergic to perfumes, metals, or sometimes plants, ivy trees and all those things. When a patch containing the substance is applied on the skin, a positive result will show a blister or rash under the patch. So this is how it will occur. All right. Now the use, how do I treat, how do I go ahead and treat the allergies? I will start treating allergies by usage of some medicine. What are these drugs? These drugs can be antihistamines, it can be adrenaline, or it can be steroid. So we have antihistamines, we have nasal sprays, nose drops, a few drugs are there which are antihistamine drugs. Adrenaline drugs, epinephrine, and all those injections are there. That they are again some medications, as well as I have got some steroids which we take in the form of injections or medications. Okay, so next so now just giving you a summary of whatever has been discussed till now. We talked about what is allergy. Allergy is nothing but an exaggerated response that is happening against an allergen or the antigen which has entered. So this allergens, it can be from animals, from food. You can have a food allergy, pollens, allergy to sun or cold, bites of bees, wasps, household chemicals, all those things are there. So there are various allergens. We have categorized the allergens into various categories. Okay. Then the treatment and the preventions of allergies is taken. We can have it in the form of antihistamines. We can have it in the form of, or we can just put it in the other way. We can have it in the form of nasal drops or injections, or in the form of tablets. Like when I talk to you about the antihistamines, the steroids, and also I've talked to you just priorly about the adrenaline. Okay, now next we talked about the diagnosis, wherein I have talked about the 3 different kinds of tests which might be there. I can have a prick test, I can have a patch test. So all those kinds of tests which are there, and the symptoms would include cough, allergic ranches, redness of the eyes, increased temperature, diarrhea, rashes, and various other things. So this is what we have studied till now. Now, what is happening? I'm telling you what is happening in a day-to-day life. See, people have become more and more very careful, being a single child of the family, that my child is very sensitive to sun, my child is very sensitive to this area, or no, I will not let the child eat this. So, they are staying in a very protected environment from the very early stage. So, being in a very protective environment from very early stage, when they move out, they do not grow the immunity. So, immunity, as I told you, you remember the thymus is very, very strong when we are small. The thymus starts reducing. So, the immunity is very, very strong when we are in a small child. So after that, a memory cells would be developed, and then after that, it will start getting immune at a later point of time. So when people earlier days, they were small, they were let out to the environment and be very friendly with the environment, so that when they grew up, they were more and more strong. They had a very higher immunity. So now, presently, what happens? The children, they actually they are very sensitive to allergen. They have a lower immunity because maybe they are in a very protected environment from a very early stage. So, to cover it up, summarize the matters, we have talked what is allergy, we have talked about various allergens that were there, we have talked about various tests, how do we diagnose it, and the treatment that is there. So thank you. Our next video will be on autoimmunity and AIDS. Then there will be a video on cancer and drug abuse. Keep waiting. Thank you.